guess nobody's come on yet. Hi. Happy Friday. It's Jen Tomko with Clarity Health Solutions. Today I wanted to take a minute to talk about trauma and PTSD and how it all relates to the COVID-19 stuff. Hi, Carrie Ann. Thank you so much for coming. I'm getting a lot, I'm a trauma specialist, so I have a lot of clients who have past traumas and they're coming to me and they're having a hard time right now. And so I wanted to explain why people are struggling and give a little bit of insight to what people might be going through as a way of helping other people get through a difficult time, or being patient with people, or even understanding our own feelings. So to start off, I just want to answer the first question. We did have a few questions that came up over the week, and I wanted to make sure they answer them. So the first one was, what is trauma? It's basically a psychological or emotional response to an experience or an event that was distressing or disturbing. The things that are most important about recognizing if something is traumatic or not is paying attention to how helpless or hopeless, powerless you felt during that time. So a trauma can be anything. It can be a divorce. It can be the losses of a loved one. It can be obviously typical traumas that we hear about, like car accidents, natural disasters, obviously past abuse when we were children, sexual, physical, emotional abuse. All of these are different types of trauma. And sometimes we're not even sure that that's the label for it. And I want to share today, like, why, how do we know if it's trauma? How do we understand the trauma better? So I just listed a few different traumatic, experiences that could be in there. And I want to explain there are three different types of trauma. We have an acute trauma, where there's one event that basically has created the trauma. So an accident, for instance, would be an acute experience. And then we have a chronic trauma, where we have a traumatic event over and over and over again. So that might be domestic violence or long-term abuse from childhood. And then we have complex traumas, where there's almost like a cascade effect of trauma. So these are some examples of when people say, oh, well, how do you know that that's a trauma? Well, it's not about the event per se. It's about how we perceive the event, if we felt that powerlessness and hopelessness during the event itself. Grief is definitely, I hear a lot of people say, well, I don't understand, Jen. Why are you calling it trauma when it's grief? And I explain to them that, the trauma is the loss of that person, sometimes how they passed away, or the residual effects, or how intense that relationship was. Those things all contribute to the traumatic piece. So one of the questions that I'm getting, hi, Nicole. So nice to see you, Nicole. Hi, Ronnie. It's so nice to see you too. Thank you for your support. So Emily's asking a question, how do I know if I'm dealing with trauma or just having a hard time? It's a great question. The answer to that basically is there are a couple of different components. First, I'll share, I was in a boating accident several years ago, and after the accident, I kept reliving the experience over and over and over again in my head. That's trauma. I was definitely going through a traumatic experience. I found myself questioning, like, what could I have done better? Did I do something wrong? What could I have done differently? And feeling angry at the same time. And after I started going through the process a little bit, that experience started to taper off. And during the first 4 weeks of a traumatic event, all of those experiences are normal, and it's called acute stress disorder. After we hit the 4-week mark, if we're still experiencing those symptoms without any reduction of symptoms, it goes into a PTSD category. So that's one of the things. So the intensity of the symptoms, the chronicity, how often the symptoms are happening, the triggers, and how you're coping, and what the event was, and how you felt during that event. So a lot of different components. Carrie Ann's asking a great question. She said, I saw someone post that trauma can't be addressed until the trauma is over. Is that true? Yes and no. The biggest answer, the most true answer probably is that is true. You know, if we're in a traumatic experience, then like we're in domestic violence, let's say, and I'm in that experience, well, I can't heal while I'm in crisis. So when we're in crisis, we are in fight, flight, freeze. And if we have a constant threat coming to us at like all the time, there's no way we can actually get out of that thought process. It's very egocentric, like how do I protect myself? And so when we're in that, we can't go to the next level of thinking. If we're in survival mode, there's no growth, it's just survival. So, you know, essentially, yeah, we really have to remove ourselves from the situation. The reason I said that that's not true is that people who are in a situation where they have that chronic reoccurrencing of a traumatic event, to go to therapy is still very, very helpful. In that it can help change that thought process, having an outsider looking at that cycle that's happening and say, look, this isn't normal. Your experiences related to this are something that can be changed, and giving those tips on how to navigate out of the traumatic event. So, but yeah, we can't really process through, but we can work on the safety thing. Emily's asking a really great question, and I think it might relate to some of the other questions that are coming up. She asked also, she said, how does trauma relate to COVID-19? So I am seeing so much, I had poor wireless connection. I just freaked out. So what I just told you, like powerlessness, a feeling of trapped, a feeling of desperation and uncertainty, all of those things are trauma related. And so if I've been in a traumatic experience, let's say in the past, where I felt powerless or trapped, it's going to be a part of my moment now. So I'm going to get reminded of that. So for instance, right now we have these pathways in our brain, and all of these experiences are sitting on different pathways. So right now, if I said to you, hey, think about happy times, you'd be able to list for me a bunch of times that you felt happy, because happiness is on that pathway and you know what that feeling feels like. Well, feeling of powerlessness or feeling what's the other word I just used? Trapped. Feeling trapped. Those are all on that pathway. So if I've been abused in the past, or I'm in an unhealthy relationship, and being trapped triggers my anxiety, then I'm going to find myself feeling that at a very intense level at this time. So being isolated or quarantined or whatever, it ends up accidentally triggering those negative thoughts, and then we end up in that downward spiral. So the way that we can empower ourselves is to take an event that may have happened. So let's say, I'm feeling powerless because I was in an unhealthy relationship, and now I'm feeling trapped in my space and I can't do what I need to do. Then empowerment would be reading articles, showing yourself that you do have some freedoms, and regain some control in a really healthy way. If we don't get control in a healthy way, we're going to find unhealthy ways, which ends up sometimes being anger or irritability or things like that. So we have to be really aware if we're getting our previous trauma experiences triggered. Also, we're seeing so much death and things like that on the news, and it's inevitable that we're going to have a response to that. And whether it's hitting us like at our compassion spot, or if it's hitting our trigger for trauma, we just have to be really aware of what's happening for us. But I want to normalize your experiences if you're having a hard time right now. So Sarah asked a question. Sarah, thank you so much. She asked, what's the best way to help children who have been exposed to trauma while we're so limited with our interactions and resources right now? I really appreciate this question. Like I had just said, empowerment is key. Giving the child choices and then celebrating their choices gives them a little bit of a sense of control in a moment where they may not have felt like they had control. So, let's call, our cousin. Do you want to do FaceTime or do you want to do just a phone call? And that's a great choice, whatever the choice is. Those little moments I'll give a feeling of empowerment and choice, and those little moments help them recognize that the decisions that they make and the limitations that they put on them, on their own boundaries, is healthy, and we want to keep doing that because it feels good when our boundaries are placed and then respected. So the type of trauma varies depending on, like, that advice varies a little bit depending on the type of trauma, but that's a pretty good, like, overall way of helping somebody with trauma. So let's see, the other thing I wanted to go over and make sure that we talked about was right now, I know that I just got a question from Carrie Ann, which is so great. She said, can one block out a trauma? Hence, part question. Will they ever remember it? Okay, this is actually probably a pretty controversial question. Yes, one of our coping skills as, our high functioning brains is to suppress memories and try not to, it's all about the avoidance piece of it. Avoidance and anxiety is under the umbrella of trauma. Anxiety and avoidance, they're BFFs, and so we have to be really careful not to fuel our BFF of avoidance. So we have to push ourselves a little bit out of our comfort zones all the time when we're trying to overcome an anxious experience. So anyway, coming back to, can we block out trauma? Yes, it's actually relatively common, but I don't think it's as common as remembering the experience. It's a level of, I guess, like dissociation. And if you ever watch the movie Precious, it's a great example of how somebody dissociates when they're being traumatized. But even in my boating accident I was talking about, I don't remember certain parts of that. And it is a protective mechanism for our brains to make sure that we can heal, because that information might be too much for us to remember. So those gaps in our memory, sometimes people get obsessed with, I have to know what happened. I have to know what happened. The problem with that is sometimes we can accidentally insert memories that don't exist. They're false memories. So if you find things coming up where you feel like I remember something, but I don't know what I remember, try to go to a qualified therapist so that they can help sort that through, because I wouldn't want you to accidentally implant memories for yourself. And the feelings that might be coming up, if you do remember, that you can have a structure to going through them. If somebody does block out a trauma, will they ever remember it? It depends. It really depends. I will never remember that part of my accident, and that's okay by me. I know that some people find themselves scratching their heads and saying, like, especially with childhood trauma, saying, I know something happened, but I don't know what it was. I don't know that they will either. And we have to learn to be grateful in that maybe we don't want to handle that. But that's a process, and sometimes it's better to remember it, but it's a very dangerous thing to try to do on your own. Please seek help for that. Sarah, thank you so much. I appreciate you sending out that positive message. I love positivity. All right, Christina, thank you so much. She asked the question, there have been so many parallels in experience for those of us who have directly experienced 9/11 and similar feelings of anxiety now with COVID-19. Are there any themes you have been noticing between these two events? I have a list I literally have a list of 6 or 7 similarities that I see between COVID-19 and 9/11. I would love to hear what other people say about this. Um, I already talked about powerlessness. I've already talked about like avoidance. You know, people, it's scary to think about going back out there. I've talked about triggers and feeling incapable of doing much. Those things are components, but other pieces of it, I think, are, you know, maybe finding blame or having, wanting to go and do something and experience the healing process for our nation. I love what's happening, how people are reaching out to each other right now. And I don't think we've seen that as a union in probably since 9/11. And I, obviously they're both tragic, and I'm not minimizing that, but I am just so grateful to see that when we are down and out, that people step up, and it makes me so proud of us in that way, especially when other things in the climate, political climate and cultural climate can be so divisive. The other part of Christina's question was, is it strange to draw parallels between these two? I personally don't think so, for the reasons that I've already said. I think that this is a traumatic event for a lot of people, and it's reminiscent of the trauma that we as a country endured during 9/11. I had said that there were 3 different types of trauma. There's, you know, acute, chronic, and complex. And 9/11 was an acute. This is a chronic. So I think that they're very related because of all of some of the similar failings. The next question was, these 2 events seem so different, and yet the trauma for so many, including me, somehow feels similar. I think I just addressed that without even having read the whole question, Christina, and I think that the pathways that I had talked about earlier in this video explain that, how we have that feeling of powerless. These certain things live on that pathway, and so it's going to draw parallels. So a lot of people might be trying to wrap their head around, why are these things so parallel? But that's why that happens. Oh, so I have Glexi with me, and she's making sure that if any other questions come up, that she can help direct me. And she just brought up first frontline responders, whether it's 9/11, the firefighters, and in this case we have the doctors and all of that. And I want to acknowledge, because I work with so many 9/11 first responders, and it's like, oh, they're my heart. I love them. And working with them has really taught me a lot about trauma and residual effects of trauma, and how we have to continually stay on top of things when it comes to trauma, because we can be triggered at any time, like now. What the 9/11 guys and gals dealt with is certainly different, but that helplessness and hopelessness of being faced with trying to save people and be a part of that positive, like, safety experience, but being unable to. A lot of times these front linemen are going to be having a really hard time because their job is to save, and they can't. And it's very counterintuitive to be there and know that you have the power to make everything okay, but not being able to actually use that power because there's a feeling of powerlessness, not having the answers or having the resources. And I have so much respect for anybody that's contributing, the doctors in particular, and even, I know across the nation with these hospitals that have been overflowing. And I just cannot imagine, it's going against your own instinct. And firefighters talk about this all the time. They say, everybody else is running away from the fire, and I'm trained to run into the fire. Like, that is a very different mindset than what the general population has. And it's the same way with doctors. Their job is to go in to heal, but yet they can't, and they're stuck feeling like failures, even if that's not the truth. That's part of our shame response, not the truth. But that's why I do think that a lot of us are going to need to be there as helpers and understand what first responders might be going through as a way for us to help them through their journey for months and years after all this is through. So watch out for your frontline persons, because they might need the extra support. So I just want to, I hope that answers the questions that you may have had about the relationship between COVID-19 and this pandemic and trauma. I think it's highly related. If you're feeling really off or depressed or anxious and you just can't figure out why, I would just look through your history and see if this feeling relates to anything from your past. And I don't want you to dwell on it, but I just want you to be able to make sense of any feelings that you might have that you just don't understand right now. But we're here. So I am going to do another live. This is my third one, and I have to tell you, it's super scary, but I'm over the moon about it, because there's so many things that people ask me, and I haven't had an opportunity like this to share my thoughts and feelings about it. So anyway, I will be on again next week at 12 o'clock, same place, same channel. You can also go on Clarity Health FL on Facebook and check us out there, and you can show yourself that you're going to be coming to the event so that you get a reminder. So thank you all for your questions. I'm so grateful to have you all. Have a great day. Happy Friday. Hang in there.